человек. 5? 16. Вопрос такой. Я, наверное, тут записывать на свой компьютер, потому что я не вижу, что вы могли это сделать. И второй момент. Вы сами объявите, чтобы они регистрировались. Чтобы они регистрировались в чате. Или мне объявили, а я им тоже объявлю. Да, начнем. Все, я ухожу тогда. Не уходи. А я не буду видеть, что творится? Ну, у меня зависит что-то. Но я буду в другой комнате. Все, я начинаю точно. Я начинаю 6 часов. Dear students, good afternoon. Today we will discuss with you next unit, and we will discuss the problem of cell death. But before the discussion, once more, I want to remind you that due to quarantine, we will have some period of online lessons. And the schedule of these online lessons for you is announced by your teachers. But I, by myself, and Tatiana Demura, for students of the faculty, will prepare presentations on 6 o'clock on Mondays, and then at 4 o'clock on Tuesdays. Okay, before the discussion, I want to remind you that in order to fulfill the program, you need to write MCQs on portal and send screen of these marks to your teachers. And also there are the tables of your groups on Google Disk, and put your marks on this Google Disk. So also this semester we will have 3 colloques, and because of these changes in schedule, we will have colloques at the end of our course. But I ask each of you to write revision 1, and then 2 and 3. And at the end, we will have colloque with the cases. And another thing is that from next week, we will have double units. For example, disturbances in circulation and thrombosis. This is the theme of our study of our unit for the next week. Okay, now I see that there are 32 students participate in our discussion, and we have only 40 minutes for this, and I would like to start. So, cell death in living tissue. The most important, there are 2 types of cell death, necrosis and apoptosis. And we will study today especially necrosis and then apoptosis. So you have very good lecture, and from this lecture you need to remember that necrosis is cell death in living tissue. So, first of all, cell death. Second, living tissue. Then, what is very important, the mechanism of this death is connected with lysosomal enzymes. hydrolytic enzymes of lysosomes. Я нажала этот режим, что такое. Давай вот так вот лучше показывать. Okay. So this is definition. Because of this mechanism, necrosis needs some time. And that is why first hours when necrosis starts, we can't see anything by light microscopy and even on gross inspection. For this purpose, we use special methods, and you need to learn them, methods of early diagnostics. And in our textbook, they are described, of course, electron microscopy, and now I will show you reaction for glycogen detection, path reaction, tetrazolum test for mitochondria, and fluorescent test. Here you can see that at early stages, when on gross inspection and light microscopy, we can see nothing, we can find changes in mitochondria. We can see destruction of mitochondria, swelling of the crystals, and deposition of calcium. Glycogen in ischemic zone, especially in zone of necrosis, disappear because living cells digest, they use glycogen for energy. And here you can see special path reaction for glycogen. And in the zone of necrosis, early stage, no staining, while in the survived myocardium, you can see red granules. And in your workbook, you need to mark the first ischemic zone, zone of necrosis early stage, and number 2, zone of survived myocardium with glycogen. So in 18-25 hours, we can features of necrosis on light microscopy and even on gross inspection. On light microscopy, we can see changes in the cytoplasm and nuclei. In order to study cytoplasm changes, we use slide number 7, ischemic acute tubular necrosis. This is shock and disturbances in circulation in the kidney, and cortex of the kidney becomes ischemic. In the cortex, there are glomeruli and tubular structures. And more sensitive for these disturbances in circulation are hard workers, tubular epithelial cells, because they perform reabsorption. That is why in these proximal tubes, we can see changes of epithelium. We can see loss of nuclei in some epithelial cells, swelling and eosinophilic changes in the cytoplasm, fragmentation of cytoplasm, narrowing of tubular lumen, and we can see in some tubules rupture of basal membrane, as you can see here. It's very important because if there is rupture, then this tube and this nephron will disappear, will replaced by connective tissue. It means that there will be no regeneration of this nephron. And what is very important, as I told you, this is shock and ischemia of the cortex. And here you can see glomerulus, and glomerulus is ischemic, while the vessels of medulla of the kidney are engorged. This is number 7. And of course, the tubular structures that have blood supply from medulla, they save their nuclei, they are unchanged. Also, necrosis is characterized by changes of nuclei, karyolysis, karyorrhexis, and karyopyknosis. The third very important feature of necrosis is formation of demarcative zone. Here you can see this is slight infarct of the kidney. Also, this is special type of necrosis. And in the border between necrotic tissue and normal tissue, and here you can see also there is demarcative zone. Demarcative zone, its biology significance include form the border between dead and living tissue, because different toxins may induce injury in of the living tissue. Then regeneration and repair of this necrotic tissue will start from this zone. This zone, demarcative zone, is also called demarcative inflammation. And this is number 3 and number 4. You can see this demarcative inflammation, engorged vessels, leukocyte infiltration. So I want to repeat. Histology of necrosis includes changes of cytoplasm, nuclei, and demarcative inflammation. On this picture from in your workbook, I think the most important part is number 4. This is demarcative zone. So, from your theoretical course, you need to know that there are types of necrosis according to the appearance, gross appearance. For example, a lot of water and
Professor?
And again, I don't understand what has happened. And another situation, absence of water, coagulative necrosis, dry necrosis, liquefactive necrosis, necrosis with water. Что случилось?
Я думаю, они хотят, чтобы вы показали еще раз слайд и сказали, где какая надпись. Где 1, 2, 3. Workbook. Они же workbook оформляют.
Понятно. Fat necrosis. I will repeat the previous slide. Yes. Caseous necrosis, fibrinoid, gangrenoid, and we will see the gross picture. Okay. So, do you want to repeat slide number 6?
Yes.
You see, this is zone necrosis. This is the number 1, loss of nuclei in glomerular and tubular cells. Then you can see clumping and eosinophilic cytoplasm of cells, the same zone. Number 3, preserved glomerular and tubular structures, but only without living cells. And the most important, number 4. I think that on this slide, the most important is number 4, demarcative zone. Number 4 here. Triangular form of this necrosis, and around you can see this demarcative zone. Once more, demarcative zone is here and is here. Is it clear? Okay. Now I want to show you the changes on gross inspection of some forms of necrosis. For example, liquefactive necrosis, in the most cases, it develops in the brain. And you have gross liquefactive cerebral necrosis. Also, another name of this gross is ischemic cerebral infarct, or gray necrosis. So the most important thing is that here you can see zone, pale zone with porridge-like appearance of the tissue, soft, and even here I can say that it is not so so early. It's late stage because I can see formation here, starting of formation here of the outcome of this necrosis, cyst. That is why for these growths, please write synonyms of these necrosis: liquefactive necrosis, ischemic cerebral infarct, and gray liquefaction. Is it clear? Can I continue?
Yes.
Yes.
So now the next type of necrosis is infarct. Infarct is vascular necrosis that depends of occlusion, thrombosis, thromboembolism, spasm of artery, and ischemia of the tissue. On gross inspection, everything depends of the architecture of the organ. For example, in such organs as brain, spleen, it has white color. In kidneys and heart, it has white color with a red borderline. And in such organs as lungs, ovaries, intestine, very rare in the brain, it may have a red color because of double blood supply, for example, in the lungs. And it is very important to remember this. I would like to show you on gross inspection myocardial infarct. And here you can see zone of necrosis in the left ventricle. It has a regular form and irregular red borderline. I think on gross inspection, this irregular red borderline can be seen better. The necrotic tissue remind boiled meat. And I want to repeat that on gross inspection, such changes can be seen only in 1-2 days after accident has been. Another infarct in the spleen. Please look, it has white color. It has triangular form because of the branching of arteries. And the branching remind the branches of the tree. And that is why if one branch is blocked, then the triangular form region is ischemic. In the heart, there are a lot of collaterals, and that is why necrosis has irregular form. White color. You may ask me why we can't see red borderline. Because adjacent parenchyma of the spleen has red color, and this borderline region is not distinguished only because of this red color of the normal tissue of the spleen. Also, please pay attention that inflammation around infarct develops also on the capsule, and capsule is covered with fibrin. In several lessons, we will study this fibrinous inflammation. This is also borderline. Gangrene. Gangrene, also necrosis, variant of necrosis of the tissues that have contacts with the air. That is why, due to these contacts, the yes, I will repeat. I want to show you the name of the substance. Due to hemoglobin ion interaction with H2S, sulfurous ferrum synthesized, and it has black color. That is why gangrene has black color. And that is why if somebody asks you where you can find gangrene, you need to answer only in organs that have contact with the air. So gangrene may be divided according to the consistency of the tissues: dry gangrene and wet gangrene. Wet gangrene, usually patients have background diabetes mellitus and microbes, and wet gangrene also develops in the intestine, because in the intestine there are a lot of microbes. On next growth, I want to show you the features of dry gangrene, which you need to write in your workbooks. So, black color of necrotic tissues, dry consistence, mummified, and what is very important, there is distinct borderline zone between normal tissue and necrotic tissue. Usually when surgeon has such patients, it is not very difficult for the surgeon to find normal tissues, because for operation, for amputation, he needs to have operation in normal tissues. What is about wet gangrene? I want to show you. This is gangrene, also growth which you need to describe. Gangrene of intestine. Here you can see the cause of this gangrene, thrombus in mesenteral artery. So consistent soft, tissues are swollen, but also they are black, and no borderline. Borderline inflammation is absent. And it's very difficult for surgeons because they need to perform resection in intestine only in the zone where they can see living tissue. So caseous necrosis, this is tuberculosis, and here you can see yellow color, and we will study next semester especially this disease. This necrosis remind cheese. So also there are another types of necrosis, but I think now we need to speak about outcomes of necrosis. So all outcomes may be classified as negative and positive. Positive, replacing of necrotic tissues by connective tissue, organization, formation of borderline capsule from fibrous tissue, encapsulation, deposition of calcium, petrification, formation of bone, ossification, cyst formation, and this is positive. But unfortunately, sometimes infection and septic lysis develop. Now I would like to show you cyst formation in the brain after ischemic infarct. In the right cerebral hemisphere, you can see rounded cavity, white walls, and adjacent tissue sometimes develop edema. Okay, next type of cell death is apoptosis. This is quite another cell death because this is programmed cell death. If necrosis, we can call accidental cell death because of the action of some pathological agent. Apoptosis is suicidal cell death because this mechanism is used when cells in the body are harmful and they ought to be killed. Mechanism of apoptosis is quite another. It connected with activation of some genes and some molecules, and especially caspases, then p53, then special molecules from mitochondria that stimulate endonucleases in the nuclei, and DNA is fragmented by these endonucleases. As a result, of course, without DNA, cell can't survive, and there is formation of special apoptotic bodies that normally immediately are phagocyted by the neighboring cells, and this is special in situ hybridization test. These are my slides with apoptotic bodies, brown color. Phagocytosis of these apoptotic bodies, which you can see on this picture, results that there is no inflammation about apoptosis. So you will see slide number 8, necrosis and apoptosis of lymphoid cells in systemic lupus erythematosus. So here you will see lymphoid follicles, and in the central part of lymphoid follicles, on higher magnifications, you can see apoptotic bodies, karyorrhexis, concentration shrinkage of the nuclei, and karyopyknosis. On the next slide, I would like to show you what you need to write.
8 минут.
Yes, in your workbooks. So number 1, tissue detritus in the central part, pyknotic and hypoclimatic nuclei, and multiple apoptotic bodies. So at the end of this explanation, I want to repeat you the most important things. Yes?
Excuse me, what's tissue detritus?
This is detritus, it means necrotic tissue without cells. You can see in the peripheral, you can see lymphocytes. In the central part, you can see only parts of the cells. Apoptotic bodies, parts of the nucleus. Is it clear?
Yes, thank you.
So I repeat, necrosis, accidental death in living body. Lysosomes, that is why we can see only changes in 18-25 hours with help of gross and microscopical, and of course, inflammatory reaction, apoptosis, activation of endonucleases, apoptotic bodies, immediately phagocytosis, and no inflammation. Okay, so Now I think we can continue our discussion with the cases. Тань, что-то не переключается. Okay, so we need to discuss with you three cases. First case is a 60-year-old man was operated for lung cancer, massive hemorrhage, collapse, I can say shock develops, the acute renal failure, shock kidneys. What pathologic process develop in the kidney? What do you think? Necrosis of tubular epithelial cells. Please remember that acute renal failure or shock kidneys, this is necrosis of tubular epithelial cells. Number two, what is pathogenesis of this renal process? Who can answer? Ischemia of the cortex, because during the shock, kidneys open shunts and blood from arteries immediately reach veins and cortex doesn't get blood supply. So if you want to describe histological findings, you may write slide number 7, which we have discussed. Number 4, what are the microscopical features of necrosis? You need to answer that these features are features of necrosis of cytoplasm, nuclei, and borderline inflammation. And number 5, under which conditions is the nephron regeneration possible? Who can answer this question? Or I will help you.
In case of reversible injury?
Yes, when basal membrane is not destroyed, yes. Reversible, where only when basal membrane is not destroyed, then a little bit later we will study with you that regeneration is possible. Do you have any questions about this case? If not, then we will discuss the next. Next case, 65-year-old man suffering from atherosclerosis, complained of severe pain in his left foot. The examination reveals the necrotic changes in the left foot. So, what do you think? What pathologic process developed in the left foot? Who can answer? I am waiting.
Dry gangrene?
Dry gangrene?
Yes, very clever students. Yes, gangrene. And in the majority of cases, dry gangrene, because atherosclerosis, if the patient had diabetes mellitus, then we can discuss dry or wet. Okay. Why has this tissue black color? Why? What substance?
Iron.
Iron of erythrocytes interact with H2S, and as a result, sulfurous ferrum develops. This has black color. So number 3, you have answered me which gangrene form is this. You answered me that it is dry gangrene. Number 4, in which form of gangrene demarcation zone is absent?
Wet gangrene.
Yes, wet gangrene. Yes. Okay, and number 5, what are the causes of the development of this gangrene form? Atherosclerosis. Thrombus, yes. What else? Embolus. What else?
Atherosclerosis.
Atherosclerosis and very rare situation, spasm, but not in this situation. Okay. If this case is clear for you, Then we will continue the next case.
So also in hypertension?
What hypertension? No, hypertension is not typical for the development of gangrene. In hypertension, patients develop infarcts of the myocardium, infarct of the kidney. Is it clear?
Yes, thank you.
Okay, and the last case, 70-year-old man suffering from atherosclerosis, complained of the lumbar pain and hematuria. Necrosis of left kidney develops due to thromboembolism of the small renal artery. What do you think? What process has developed in the kidney due to thromboembolism of small renal artery? What do you think? We have studied this slide, not gross, but slide. I told you. Okay, I'm very sorry because of technical problems, and I would like to continue. And then I will answer your questions. So, case number 12. So here we can speak about infarction of the kidney, because thromboembolism in small artery, this is infarct. So how can this necrosis can be characterized? Of course, this is infarct. And common histological findings in the kidney, you will see, we have done slide number 6. You will see everything there. So consequences of this necrosis may be different. Organization, encapsulation, petrification, bone formation, and unfortunately sometimes septic lysis. Okay, so our time is nearly finished. That is why I want to... Как 40? That is why I'm waiting for your questions. So do you have questions?
Yes, Professor. Can you go back to case 10?
To case 12 or 10?
10.
Okay, 10. Yes.
You said the first question, I didn't understand it really. Why are the kidneys affected by this?
Okay, it's very simply because you see, I told you that this situation develops when patients have shock. Shock, it means very low blood pressure. So in order to survive in these conditions, there are special mechanisms of compensation. These mechanisms are called centralization of blood circulation. It means that blood is accumulated only in the vessels that supply circulation of the heart, brain, and in aorta. And in order to develop this centralization, organs change their blood supply. They open shunts between arteries and veins, and blood immediately from arteries through these shunts go to the veins. So in the kidney, these shunts, they are localized in the border between cortex and medulla. Shunts open, blood from arteries through shunts enter veins, and there is ischemia of the cortex. These tubular systems, proximal tubes, they are localized in the cortex. They have ischemia, and as a result of this ischemia, they develop necrosis. Do you understand my explanation?
Yes, thank you very much.
When somebody will ask you, you need to describe this mechanism. What other questions? What other questions? Okay, so, and if it is clear for you, the apoptosis, this is suicidal death, and is very important because if damaged cells sometimes are not come to enter apoptosis, they may accumulate mutations and that may result in cancerizing. Okay, so if you don't have any questions according to my explanation, so I want to repeat you that our meeting will be next Monday. Is it suitable for you at 6 o'clock?
Yes, Professor.
Okay. And we will discuss 2 lessons. We will discuss lessons 7 and 8. It means congestion and thrombosis. That is why during this week, please prepare these 2 lessons. Also, if you are interested in, I may speak with you about COVID-19 situation in Moscow.